You can go live now.
Good evening, everybody. Welcome to this webinar on coping pregnancy loss. We have Dr. Vidya Bandukala with us to address this coping pregnancy loss. Welcome, madam. Welcome to this webinar. And over to you for your insights.
Thank you, Dr. Prashant. And
Thank you.
hello to to all the viewers, and thank you for joining in. This is kind of an awareness program because October is a month of early pregnancy loss awareness. And as we all know that pregnancy is a very auspicious moment for a woman. One is because she is, looking forward for a different role in her life as a mother. And I think all of us as women look forward for this moment. So it's a very auspicious moment, and you plan so much. And these days with the new generation, the Gen X that we talk of, are so planned in their approach to motherhood. We have the internet, the social media, and all, giving us all the positive approach of planning a healthy pregnancy. But at some point, even though you are planning, even though you get a pregnancy, it is not necessary that the pregnancy will end in a good note. And this is the time, this is the awareness that we want to put forward, that if the pregnancy is not going as per as our plan, then how does it affect a woman? It's a moment of shock, a grief, a feeling of guilt, and all emotions bundle up in a woman. Some are able to be vocal enough to voice their response, whereas some just are not able to take it. So today, I'm just going to be speaking to you that how, when you go through these events, it's a phase in life, not all, but a few of them may somewhere in the others come across. So today I take this opportunity to speak to all of you as a general patient awareness, where how we could look at such an event and manage to overcome the phase of losing a healthy pregnancy. So let's begin with a pregnancy that is viable. We divide our pregnancy in weeks, and we take it as 40 complete weeks. Of course, the weeks can go 1 or 2 weeks ahead, where we say there is postdatism. But any pregnancy that reaches 37 weeks, completed weeks, we call it a term pregnancy. But a pregnancy in 40 weeks are divided into 3 trimesters, the first, the second, and the third. The loss of pregnancy could be an early pregnancy loss or late in pregnancy. While we decide to talk about the early pregnancy loss, we will divide it into the first 3 months, which is up to the 12, 13 weeks, and later up to 20 weeks. Ideally, any loss before the 20th week is called a miscarriage. But once you cross the 20th week, there are developed countries who are able to manage these fetuses in the NICU, that is the neonatal intensive care unit, and help the baby to grow in the incubators. But in underdeveloped or developing countries, we take up to 22 weeks as a miscarriage, because it's very difficult with our equipment or with our NICU not being so well equipped to manage these kinds. So let us talk about losing a pregnancy in this first 20 weeks. In a healthy pregnancy, everything goes well. I always relate a patient, I talk to them saying that it's like having a good seed versus a bad seed. You sow a seed in a absolute non-manured soil, you know the outcome is not going to be great. But if a seed is planted or sowed in a well-manured, well-nourished soil, it definitely will grow and do well. But also, if a seed which is not of good quality is sowed in a soil which is well manured with good sunlight, watered every day, it will still not grow because the seed itself is defective. So let us understand that once the ova, as we call as the female egg, and the sperms, when they meet and they get fertilized, they form embryo, and this embryo then goes into the uterine cavity, and the lining that we say, the lining that is nourished by the hormone progesterone, helps to implant the embryo, and it nourishes the embryo so that the embryo grows into the fetus. This is a very, very crucial time, very important moment for the whole pregnancy outcome. So if the embryo is good, it will grow. And as we document, the earliest documentation that we do is by the urine pregnancy test and the blood test, which we call the beta HCG. These are the two tests which can help us to know whether a patient is pregnant. Now, sometimes in the urine, you may not get it, or you may get a false positive. So it's very important to document it. We usually tell our patient, because we also go back to her menstrual cycle. If she's had irregular cycles, maybe she has conceived late, and hence she may not get a positive result even at the 5th week after missing a week, or she's overdue by a week. So it's very important to wait in patience, because it takes time. And if you want to know instantly, then the best specificity and sensitivity is the beta HCG, which is a blood test, which gives us the result instantly and lets us know. Also, if we want to know whether the pregnancy is going well, we normally need not just one beta HCG report, but in 48 hours, we see a doubling of the beta HCG, and that is when we know that this pregnancy is going well. If the pregnancy is not going well, where we know that this pregnancy is not in the womb, but maybe we have ectopic pregnancies, which is where the pregnancy is not in the womb, but elsewhere, maybe in the tubal part, or maybe outside of the tube, maybe in the ovary or in the peritoneal cavity, which is inside the abdomen, but not in the womb. It is called an ectopic pregnancy. The beta HCG may not raise or not double up as per the documented level it should. So this is the biochemical method of knowing your pregnancy. The other way is the ultrasound. Ultrasound is an eye to a gynecologist, especially the obstetrician, because early pregnancies as early as 5 weeks can be picked up by an ultrasound. Ultrasound can also help us where sometimes we are not able to see the pregnancy in the womb, and we then probably correlate it with the beta HCG. And if the beta HCG levels are high enough and still we are not able to see it in the womb, then we look at the tube, the ovary, and elsewhere to see if there is a pregnancy sac. So that helps us to demarcate the two. So if we are able to see the pregnancy in the womb and we are able to see that it is growing, so we need to document it till we are able to see the cardiac activity, which is more or less picked up by the 6th week of pregnancy. So this is how early a pregnancy can be picked up. Now, what are the other signs and symptoms of pregnancy? We all know a few of them, or most of them, do have nausea. Some of them may have absolute loss of appetite, vomiting, feeling of lethargy, sleepiness, mood swings, not interested in the surroundings. This is all absolutely normal feeling. I think as women, knowing all our past history, where our mothers, our grandmothers never had an ultrasound, never had any biochemical test, but they had all these signs and symptoms, which were a sense of feeling that my pregnancy is going well. So this is a welcome feeling for all those who wanted and planned a pregnancy. So when the pregnancy goes well, the ultrasound picks up the cardiac activity. It picks up the growth in the length of the, where we call the crown rump length. So this is the length that we correlate as per the weeks of the gestation, and it helps us to know that the pregnancy is going as per the date. So we have a viability test, a dating test, and this allows an obstetrician to feel that everything is under control. And so can we convince the patient that things are all going fine. Now, when a patient has been seen prior, say about 6, 7, 8 weeks pregnancy, where we were able to see the cardiac activity, where we were able to give the crown rump length, and we knew everything is going fine. But one fine day she walks in and she is taken for an ultrasound, and we see that there is no flutter or there is no cardiac activity or the growth of the fetus, which is not coinciding with the gestational week. That is a red flag for us. That is a sign that this pregnancy is not viable. It is not going as per the gestational age. It is lagging. And this is the time. It's a very difficult time for even an obstetrician to speak to a patient. You see, every patient, an individual who comes to us, is as emotionally attached to us as much as our family is. We want to give the best to our patient. Which doctor would not want that? So when we see such a scan and we are documenting it right in front of the patient, the emotions in us, I'm sure the patient can get the feel of it. But it is our time to control our emotions and bundle up all of them and be ready and be prepared to speak to the patient, because we don't know how each patient will take the result of a pregnancy loss. So it's a very, very emotional moment for us. And every patient is looking forward for each visit of hers to be fruitful. So pregnancy loss is seen and documented through an ultrasound, especially in the early weeks of pregnancy. In some cases, the patient herself can document it by coming with the complaints of spotting or bleeding through the vagina, or a history of passing some tissue out of the vagina. Now, these are red flag signs for her as well as us to know that something is not going fine. Sometimes, even though you are having spotting or you are having bleeding, does not mean that the pregnancy is not going well. No. There are times when you could have bleeding and spotting, but the pregnancy is going fine. But that is a complete different set. And I wouldn't want to go deep into it because that will take a lot more time. Let's only get into what pregnancy loss means and how, as a patient, you must learn to cope with this result. So while we sit with the patient, we must, I think, as an obstetrician, I have to let her know as a patient that, this is an unfortunate event. I mean, we were all looking forward, not just you, but even me, looking forward for a healthy pregnancy. But unfortunately, things are not going in that direction. And as a patient, you must take your time. It is a very shocking news. It is a very, a moment of grief for you, but you must take that time. You must take your emotions and let it heal. It is absolutely normal, absolutely fine to feel your emotions, because it is only you going through that feeling at that moment, because you were looking forward for a very healthy, fruitful pregnancy, especially in these days when you are planning for a pregnancy. You already had a pre-counseling, preconception counseling, and you're looking forward for a healthy pregnancy. And you wonder, why did this happen? Did I do something wrong? Did something in the environment go wrong? Please do not blame yourself. There is no blame game here. Nobody would want disaster for oneself. So accept it that that is nature. There is something in nature that nobody can control. Fertilization is such a very crucial moment or a episode which is taken in a micro environment in our body. It's very difficult even for our infertility specialist or an IVF specialist to know what is happening at that environment in the tube, in that micro, what went wrong, whether the ova was not of good quality or whether the sperm was not of good quality. It's very difficult to answer, very, very difficult question to answer. But what is important is not going back to that, but accepting what is there in front of us. There are a lot of reasons. We know that 15 to 20% of pregnancies, or healthy pregnancies, can end up in an early loss. It's easy to say though, but at that moment it is very difficult to accept and gulp down that feeling. But it's very important that do not blame yourself. You must give time to overcome the feeling of a loss. Even though you know everything, every individual takes the loss in a very different way. As a patient, speak to a person who can understand you or who is your confidant. It's always better to speak up. You see, because what will happen is just keeping it in you may make you a different individual for that phase. Try to get out of it. Speak to people, communicate to your doctor, find out what are the ways. We just cannot look at a pregnancy loss for that moment. We need to work around it. But take your time. It's very important to just feel and overcome the loss. I know it is a very overwhelming condition, but take your time. Have enough support. You can speak about your loss to anybody around you the way you want to speak. And there are times when a person may not be able to give you the support that you want, because you know these are losses which nobody will be able to feel until they go through it. So maybe they may not be able to verbally speak to you, but just being around with you is all that you need. So I would always say that find a support, find a confidant in a person who can help you. Take your time. Your obstetrician is the right person to speak to. Find out, but don't sit back and blame your circumstances, your environment, and yourself. That is not the right attitude. Because it's like everything going right, and there is a sudden change in your itinerary, which may not be, as enthusiastic as we wanted it to be. So that change can also, it's like a child, you give a toy and you just take it away. That feeling is so horrible, and it just puts you down. It makes you feel so guilty for just doing nothing. So don't get into that guilt trip. Get out of it. The first meeting may go in a very silent way. The first meeting with an obstetrician is all about understanding the loss. And it may not end with what and how to manage the further process. So it's absolutely fine. Even as an obstetrician, I probably can give the patient and the relative accompanying the patient some time. That take your time. We will need to sit and speak about this process. But before doing that, let's give some time for the patient. Going through a pregnancy loss, maybe one time, 2 times, 3 times. There are times where patients have come and they've had pregnancy losses. It's very difficult because 50% of the time we would not know why the pregnancy did not work well. There are a lot of battery of tests that can be done, but all the tests may come out absolutely normal. So when you have a pregnancy loss, as an obstetrician, I may not give you all the tests required. But yes, if you have another loss, then it is the responsibility that I take upon myself to work up on the patient and maybe do all the chromosomal karyotyping. There are other battery, immunological testing, all these tests put together to understand how much we can work on this patient for a healthy outcome in the next pregnancy. So all these things are very, very important. As we all know that in early pregnancy loss, most of the time there is an abnormality. There could be a chromosomal abnormality, and it is better now that this pregnancy did not go forward, but ended up. It's the nature's way of throwing out something that is not good in our body. I always tell the patient, sometimes it is a positive note because it's very difficult to have a baby with a disability. And some of the abnormalities, the congenital abnormalities, the inborn abnormalities are very difficult to pick up in the early weeks of pregnancy and are picked up only after the later part of pregnancy, even cardiac abnormalities. Hence, we have certain tests, we call it the anomaly scan, where we look at all the anatomical structure of the baby, including the heart, the brain, the liver, the kidneys, all the vital organs. And these tests are so important. I would not want to miss this test in any individual, poor or rich. Any woman should not miss her anomaly scan. The level 2 scan is so important because this is where we pick up. You know, people say during our days, we never had this, but I'm sorry. Those were the days when there was no documentation of the losses. Those were the days when out of 5, 6 kids, 1 kid had problems or 2 kids have problems. Today, I do not want that for my patient. I would want my patient to at least know basic things, basic anatomical structures that are fine. So anomaly scan and all this help us to know whether a pregnancy or a fetus is in good shape. Of course, 2 to 3% of the cases will not be able to document even after the baby is born. It takes time then with the developmental milestones. But that is something we as doctors also may not be able to. We have not reached that level as yet to know things in the future. But what is in our approach, I think we work towards it because, as I said, we all look at having a healthy pregnancy with a good outcome even at the end. So when I say that there is a pregnancy loss and I have counseled the patient, I have kind of sat with her, you know, tried to balance her emotions and let her know and let her grieve for that moment, because that is the time she will require. Because it's not, you know, losing a pregnancy may put her into anxiety, depression, a post-traumatic stress disorder. These are so important today because mental health is taking a big toll in the younger generation because whereas it is already so stressed out in our day-to-day activity. Taking a break for pregnancy is a big hindrance to a career in a woman. So today's woman who's already in all walks of life just does not want to interrupt her career and then get an early pregnancy loss or even a pregnancy loss in the late phase of her life. I think that's like going through hell for a woman. So to all those who probably have gone through what I'm speaking, I know how difficult it must have been for you all. But I think, you know, there are enough and more support groups that are now available on the net who help you to overcome your loss and to work towards the future on how you could manage to have a healthy baby. So let's now talk about how we could put ourselves into a healthy environment so that we could have a healthy baby. We all know that today we are preparing to be a mother in the late years of our life. So when I say late years of life, the peak age is 25 to 35. As you go beyond 35, approaching 40 and 45, our fertility goes down, and so does the quality of our eggs. Now, these are the age group where we are not able to even tell them that this pregnancy is going to be healthy. So in these kind of patients where they are preparing for a motherhood in a late 30s or early 40s, I prepare the patient. I actually speak to them that say that these are the things that we will need to work on. There are screening tests. There is screening test for trisomy, which is Down syndrome. These are very commonly seen in the later part of the maternal age. So maternal age is the most important criteria for a good quality ova. So in these patients, we definitely do what we call it the dual marker or the quadruple marker, where we look at a combination of biochemical test and the ultrasound, put them together and see the risk of you carrying a baby with a Down syndrome or even a neural tube defect, which means the brain and the spine not developing in the right. With the advance in the ultrasound, we are able to pick up all these kind of in the first 12 weeks. So I believe that we must look at technology as a God's gift to us, because these gifts actually give us an understanding of whether we are carrying a pregnancy which is healthy or not. And then, of course, when there is something not going right, we speak, to the couple and we talk to them of what are the pros and the cons of a condition and how it will reflect on the baby in the future. So it is a very informed kind of an understanding or a consent that we take with the parents, because sometimes when there is an abnormality which may not be viable for the baby, it is informed understanding between the obstetrician and the couple where we terminate the pregnancy in the early phase, so that that woman may not be, she's not ready to accept an unhealthy pregnancy. I know as much as not seeing a viable pregnancy on an ultrasound versus knowing that the cardiac activity, everything is going well, but there is a gross deformity in the baby and this pregnancy will need to be terminated. Both. One is a very natural way and one is so not natural, but having problems and we need to terminate. Both are losses. Both are pregnancy losses. And it is so difficult for us to speak to the couple or a couple to accept that there is a problem, because they were looking forward for this pregnancy. They were planning this pregnancy for months together. The woman has taken a break from her high-flying profile job. And then when she comes with this kind of a response, it is a devastation of, her thought process, her being. So taking a loss is not easy. And I think as friends, as family, we must be there to support any woman who goes through this phase. Not becoming pregnant is another ballgame, but becoming pregnant, knowing that, you got the joy of life, but you're not able to go with it forward, is a very, very difficult moment. So you have to learn to cope up with this situation. Now, as an understanding, once you know that you are carrying a unviable or non-viable pregnancy or a pregnancy which has a lot of abnormalities in the baby, deformities in the baby, and needing to do the termination. Now, there are 3 processes that we look forward. Sometimes if it's an early pregnancy or this, we have an expectant management, we have the medical management, and we have the surgical management. We actually see in what phase the patient belongs to. If it's a very, very early pregnancy, thanks to the newer advances in our obstetric practice, we are able to do a medical termination. But of course, there are pros and cons to that. and we need to speak. So everything today is all about speaking to the patient, communicating to the patient, and what patient wants for herself. It's so very important today that we have to have a very transparent understanding between the patient and the doctor. Well, many patients think that, oh, the doctor was at fault. She did not start me on certain medications and she did not. Oh, that's all a blame game. No doctor would want a patient to go through this phase. Believe me, it is as difficult for you as much as it's for me. So today, it's all about understanding and partnering with each other. We need to partner with each other. We need to understand that we both want to have a healthy outcome of the mother as well as the baby. Unfortunately, in our scope, we can only do the best that we can. But as I said, that about 2 to 5% of pregnancies cannot be predicted. And 50% of the time, there is no cause. There is nothing. Now, what is the best way of putting ourselves in a healthy environment? One is try and not go into the later part of your maternal age. It's very difficult, I know. But today, if a woman is into her career, forefront in all her job profile, I think there are egg freezing. You must take the opportunity to go forward and talk to your physician about this, because that biological age will remain when you are prepared to accept your mother. Second, with all the vices that is going around, smoking is one such vice, which is not good. Alcohol. So everything in moderation, or I would say just stopping it at the right time, even passive smoking is not good. Having a preconception counseling, at least in 90% of the patients, the outcome comes good. To just know if you are obese, trying to lose weight, if you have a PCOD kind of profile, all that picked up at the right time can help us to bring a good outcome for you. So understanding all that, there are immunological factors, but of course, we do not do that for all patients. But there are certain, family history of having abnormalities can be picked up and can be diagnosed even before you step into your parenthood. So these are the ways that we look forward in a couple who comes for a preconception counseling. If you have a history of diabetes, you must control your diabetes, because high blood sugars can damage the growth of the fetus. So it is very, very important that you get your sugars timely done, keep a control of your sugars, take charge of your body, be in the good, healthy, fit state to accept a pregnancy. Because as I said, it's not just about early pregnancy loss, where we look at only the fetus, but we also look at the outcome for the mother, because both are as important to me as much as, just having a healthy pregnancy. So we look at just not the fetus, but also the mother. The primary fact is that mother is more important to me. Her health being at the utmost height of fitness, I would say, to carry a pregnancy forward is very important. So as I said, that pregnancy loss is never a fault of anybody. So please don't blame yourself. Have an environment that can help you to go with a healthy pregnancy, but be prepared to accept any kind of, you see, I'm not saying that every pregnancy should end up with, but always be prepared, because this is nature. We have to go with the flow. What we decide and what we plan may not be the plan for us. So accept it in the right frame of mind. Be strong when you accept a loss, because if it is healthy, there is no question of talking with the patient. But when things are going wrong, we are here to help you to overcome, to understand, and to plan your future. That's very important, because any loss that we see, we just don't take it as a loss for the moment, but we take it as a loss where we do not want you or us to make any kind of mistakes for the next pregnancy. As I said, there are losses even after you take every step needed. And that is the time when we know that something is not going right inside. For example, if the womb has a partition, we call it a septum, or if the womb has some abnormality called the bicondylar uterus, these are conditions where pregnancies may not go, or you have a fibroid in the uterus. Now, these are conditions that can be picked up by an ultrasound. And if it is picked up at the right time, so before you plan a pregnancy, get yourself sorted with all these. Some can be done with surgical management, some can be done with medical management, but these things have to be taken and understood and acted upon. That is when we know that we will move forward. But as I said, even after doing everything right, we still cannot promise a patient that this pregnancy will 100% go in the right direction. We are not gods, but we are here to pick up what may go wrong and correct it and give the corrective measures for you. But if there is a deformity in the fertilized process or the embryo or the implantation did not go right, or there is immunological factors, these can be picked up. These can be taken care in the future. So do not take a loss in a negative mode. Take it in a positive feel that yes, something did not go right. And some things need to be corrected before I plan. Give yourself that much time. You know, we always say at least 3 to 6 months minimum, don't plan a pregnancy. One is because you mentally need to feel that, overcome that, get your body fitness in the right frame, and then plan. And before you plan, always meet your obstetrician, because as we say, some of the patients, they have the neural tube defect. We actually tell them that go on folic acid at least 3 months before you plan a pregnancy. Even in diabetic patients, we put them on folic acid. There are certain other things. There are hormonal changes. The progesterone, which is the mother hormone for the pregnancy, is so important. We see that in PCO patients or in certain patients, they have something called the luteal phase defect. This is where we see that the progesterone is much less in them. And it takes a few weeks for the placenta to completely get prepared to take over the management and maintenance of pregnancy. And this is the time the ovary takes charge of the pregnancy, and it may be lacking on the progesterone hormone. So sometimes supplementing progesterone can just help, especially in when you get signs of spotting or bleeding, which is the red flag sign for us. And we need to act upon it. Those studies have not fully documented that progesterone could be the cause of a loss, because they don't know, is it a consequence of the loss, that's why the progesterone went down, or because the progesterone was low, that the pregnancy didn't. But nonetheless, if it is not harming any patient, I would still go with the supplementation of progesterone to the patients who had PCOS or who had a previous loss. So sometimes it is better to supplement than not supplement. Also, if a woman is in a very stressful environment, I would always recommend that de-stress yourself. Take a job profile which is easy for you. You know, even in a place like Mumbai, commuting is a big disaster. It's a lot of stress for a woman. You know, you have all your signs of pregnancy, your symptoms of nausea, vomiting, not being able to eat, and then you're commuting for hours in that stressful environment. I would say just take it easy. I'm sure all the high corporate job profiles today are very friendly to maternity leaves. So I think it is always better to communicate. Please communicate. That's very important. Unless you don't speak your mind, nobody is God enough to understand you. So speak. Communication is the skill that is required in every walk of life, even as a patient, even as a support group. If I want to support you, I need to know what's in your mind. So speak to your obstetrician, speak to your family members, speak to your partner or your friends. and let us know in what way we can support you. So I think I covered up with pregnancy, all the 3 phases. What is the early pregnancy loss that we are looking at? Some time I think I missed where you can just miscarry if the neck of the womb, we call it the cervical canal, is not able to support or hold your pregnancy, and it opens up, and this is called incompetence of the cervix. And all we require to do is to timely put a stitch around it and give it a tight hook so that it prevents that part to be incompetent and competent enough to hold the pregnancy. So as I said, if we pick up what did not go right, we are able to give you a better outcome in the next pregnancy. So do not take your loss as a last resort. It always should be worked upon in a very positive note, very strongly, to the future planning of your pregnancy. Do not be in a haste to plan your second pregnancy. Always have patience enough to understand what went wrong or what was not right at that moment and correct it before you step into your pregnancy. Losing a pregnancy is a lot of emotions. It's not, every individual can grieve in a very different way. So as people or as support around that woman, we must understand that everybody has a different threshold to accept a loss. So respect that woman for what she's going through, help her to overcome the loss, rather than, pointing out that, oh, it happened in an early pregnancy and, why is she making such a big hoo-ha? No, I'm sorry. Nobody can speak that for anybody today. Everybody has their own mindset, their own ways of dealing with things, and we must learn to respect it. Support such women, be there for them. And I think I've covered with most of the points. If there are any questions that I need to answer, I'll be more than happy to do so. Dr. Prashant?
Okay, madam. Thank you very much.
Yeah, I would just
Thank
end up. I would just end up with 2-3 sentences more. That every patient who goes through a loss, I think she should decide whether she wants to convey her news by her own self or through her friends, because it's very difficult that, after you have a loss, when you meet people and somebody just pops in with a question of, oh, how is the pregnancy going on? It's a very difficult moment. So you must be prepared to let people around you know that you've had a loss. It's absolutely fine. It's absolutely fine to speak up on your own or to let people around you know, because, it's very difficult to accept in a crowd somebody asking you about how things are going on. So don't, feel the guilt and put it on you, but speak it out. Today, with the era of the internet, of the Google, of the social media, people are coming out and speaking what they went through and how they did overcome their feelings and how they all, had a pregnancy that had a healthy outcome and they are having grown-up children, So learn to accept things in the right way and work towards the future. Thank you. Thank you so much.
Thank you, madam. Thank you, doctor. Thank you.
Yeah.
Thanks, everybody.
Yeah.
Thank you.
Thank you. Thank you to all the viewers. And
Thank
I hope
you.
it was helpful enough, because only those who have gone through or those who have had their sisters or, close friends who have gone through this loss can understand what I spoke today. But as a patient who's listening to me, you need to take a pregnancy loss in a very positive note. Take time to go through what you're going through. Take the help of people around you. That's very important. And most important, speak to your obstetrician. Take the guidance and don't be in a haste to plan your second pregnancy. Take time, be prepared, go for a pre-counseling so that you know that you're ready to accept another pregnancy, and always have a positive note in your mind. Thank you.
Thank you, madam. Thank you so much.
I hope I covered up most of the
Yes,
things.
yes. Lovely,
Very informative. Very
Yeah.
nicely handled.
Yeah. Okay.
I mean, yeah.